Hey guys, so in the OR today, we were talking about training for scrub techs, for nurse practitioners, for nurses, for physicians. And I realized like how little I know about how other specialties are trained versus physicians. And a lot of people probably don't know what doctor training is like other than med school residency. So let's go through it. First, you have to take your prereqs for med school. That's organic chemistry, physics, calculus, biology, biochemistry, I think are the big ones. And then medical school, so your whole first and second year are in the classroom and you're learning anatomy, so that's our cadaver lab. First year is generally like you're learning how things work in general, and then second year you're learning how the disease processes affect their system. So like we had a whole section on the heart and vasculature, whole section on pulmonology, whole section on how your kidney works, how your liver works, anatomy, neuroanatomy. So then second year, you're looking at the disease processes. Like, here's what happens when you're in diabetic ketoacidosis. Here's how it's affecting your lungs and your kidneys. And you're also learning some of your pharmacology and your microbiology second year. Truly, I have probably forgotten more than I ever learned. It's crazy how much you learn and then you don't use it. But then, like, I'll talk to a different specialist and kind of remember, oh yeah, that is how that worked. Okay. So it's first and second year. Third year, you're on your clinical rotation. So at that point, you're shadowing the medical team. You generally are assigned patients so that you'll take a history and physical, you'll do your physical exam, because those are skills you also learn first and second year. How to take a history, how to write a note. There's a lot of info. How do you organize it? There's a standard to that. How are you doing your physical exam? That has kind of fallen by the wayside a bit as we have better diagnostic testing, but also like what's going to trigger you to order what test? What are you looking for in the history? We had whole tutorials on like, okay, this person presents with abdominal pain. What are the questions you need to ask? What tests are you going to order? What are you looking for? What do those answers mean? So then third year, you kind of start to get to see how that's put into practice, but you're also seeing what all the different specialties are like. So you rotate through neurology, through surgery, through primary care, through internal medicine, through psychiatry. So you can see what all these different doctors actually do on the day-to-day. And that's kind of when people start to pick their specialties. Fourth year, you're doing more electives and you're applying for residency. So you do have a little more downtime fourth year. And you also have exams sprinkled throughout, step 1, step 2. That's the USMLE, the United States Medical Licensing Exam. Okay, so then you finish fourth year and you go into residency. I can only speak to plastics. It's a 6-year residency now. It was 5 years when I did it. Intern year, you're kind of learning how to function as a doctor. This is the first time you can actually write orders. As a med student, you were kind of thinking like, oh, this is the process that's going on. This is how we're looking at things. This is how we're consulting other teams. You're kind of seeing how the process works. That intern year, you're starting to implement that process. You're the one who's got to call infectious disease and then follow up on the consultation and carry out the recommendations. You've got to learn how to discharge people, how to write prescriptions, how to write discharge summaries. You're the one who's checking everybody's labs and making sure things get done. You're starting to come up with plans like, hey, I think that this person needs this test and then we'll do this consultation. But you're doing that in baby steps with your senior resident overseeing and guiding everything. Second year for surgery, you start getting in the operating room a little bit more. At that point, you're kind of learning like, okay, here's how we do pre-op orders. Here's how we do post-op orders. And you're starting to see a little bit of the technical stuff. By third year, you're doing more of the technical stuff. You're usually like the main assistant in surgery. You do rotate through the surgical specialties your intern year too, so you can know a little bit about what goes on in cardiothoracic surgery and what goes on in orthopedic surgery. But you're getting this gradual increased responsibility with someone there holding your hand and checking on you the whole time. So by your third and fourth year, maybe you're taking care of all the floor patients. I remember on transplant, like the third year resident was basically keeping everybody on the floor healthy, making sure tests got ordered, making sure stuff followed up. You're teaching the junior residents. You're in the OR some for cases. And then my fourth and fifth year was when I was really in the OR a lot. So fourth year, you're learning how to do the cases yourself with a senior resident right there and an attending there, and they're starting to show you the steps. By 5th year, you're the one creating the plans. You're like, this person needs this surgery. I'm going to schedule it. Here's how I'm going to do that. Here's any pre-op tests we need. I'm going to learn how to do this surgery. Then you do it. Then you got to worry about the post-op care. When are you going to see them back? How are you going to get them into physical therapy? So by that point, you're kind of like, you know, the training wheels are almost off. You're checking in with the plan. There are some things that you're doing totally independently, but you're checking with your attendings continually, and they're kind of guiding you. It is a very slow, gradual increase in responsibility, because these are people's lives and these are people's well-being. It's a huge thing, and it's a very long process of learning and applying. So it takes a while, and that is how long it takes to become a plastic surgeon.